Welcome to Infant CPR Station. I'm Matron Tan from Hospital Pinang Cardiology Department. As you all know, infant age is between 1 month to 1 year. So, in case of infant collapse, what we should do? Usually, we will follow the DRS ABC like adult. Okay, so what is D? Of course, D is danger. Okay, we should make sure there's no danger between the victim and we all. Okay, so once you clear the danger, you will go to R. How to check for response? Response is usually infant more sensitive to the sole, so we can just tap the sole. Okay, tap, see whether got any response or not. If there's no response, you'll go to, after D, R, you have to go to the S, shout for help. Okay, ask the victim's mothers or relative to call for help. Call for 999. After that, you go to the A. What is A? A is open airway. Okay, how to open the airway? I will show you how to open the airway. One hand, put over here. Two fingers, put at the bony part and just lift up a bit. Do not hyperextend the neck. Okay, open airway as usual. We just want to make sure that tongue won't fall backward and block the airway. Okay. Then come after the open airway, go to B. B is breathing. Breathing, you need to check for look, listen and feel as I shown here. Okay, put your face near to the victim's nose and also the mouth. Okay, then look for the chest rise. Listen for the air breath and also feel for the air. Okay, for 10 seconds. So inside your heart, you should count 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000. Okay, within 10 seconds, there's no breathing. We would like to give 5 rescue breaths like this. Make sure we need to seal the victim's nose and also the mouth. After the 5 rescue breath, you need to check for the pulse. Usually, you need to check for brachial pulse. Okay, brachial pulse is somewhere nearby here. It's 1/3 from the internal part of your arm here. So, you can feel for the pulse for also not more than 10 seconds. Once there's no pulse, you need to start the compression. The landmark for the compression is put your 3 fingers on the nipple line at the center of the chest. Okay, lift 1 finger up. So, it should be 1 finger below the nipple line and you need to compress for 15 times. What is the depth of the compression? It's roughly 1/3 the AP diameter of the victim's chest or 4 cm like this. Okay, 6, 7, 8, 9, 10, 15 and 2 blow. Usually 1 blow over 1 second. Okay, you need to do for 5 cycles. After 5 cycles, you need to check back the pulse again for not more than 10 seconds. Okay, if the pulse available, if the pulse is present, so you need to look back to for the breathing. Now you need to look, listen and feel again for any 10 seconds for any breathing. Okay, if there is no breathing, then now we are going to rescue the breathing side only. So you can blow every 3 to 5 seconds. How to blow every 3 seconds? 1 blow is 1 second. If you want to give 5 seconds per breath, so the first blow is 1 second. In your heart, you need to count for 2,000, 3,000, 4,000, 5,000. Every 1,000 you blow. Okay, I'll like to demonstrate again. Okay, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. You need to do for 1 minute. So if you want to give breath every 5 seconds, 1 minute you should have 60 seconds divided by 5. You should have 12 breath per minute. Okay, every minute finish, you need to recheck back the pulse again. Okay, check the pulse in case patient might stop beating, the heart might stop beating again. So if still present, then go back to look, listen and feel for 1 second. If breathing present, then you can put the baby in recovery position like this. Okay, maybe, or if there's a pillow, you just support at the back. If not, you can just hold the baby like this. Okay, first you can, patients, the saliva can come up easily. Okay, we can observe the patient also easily. You can put your hands over the pulse here, then you can look for the breathing. Okay, although it's in recovery position, but we still need to check every 2 minutes until the ambulance came. Okay, that is one-man CPR. Okay, in fact, we have two-man CPR also, but the method is one person will be doing the background mask and myself will be doing the two-hand encircling method. Same thing, put your hand at the one finger below the nipple line, then you can just press it 15 times. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Assistant will back for 2 seconds. So 15, 2, 15, 2 for 5 cycles. After that, same thing, need to recheck the pulse after 1 minute and recheck back the breathing. If both also not present, continue again. Repeat again the cycle. 15 compression, 2 breath. Okay, I think that's all for the infant CPR. Any questions?